The Clinical Dashboard by Molly Strange. Overview of quality safety measures in organizations. What is a quality dashboard? A quality dashboard is a tool that may be used by healthcare facilities to present performance data in a graphic view in order to determine quality performances and comparisons between yearly quarters. What is a quality indicator? A quality indicator is a specific measure in which patient care performances are reviewed, such as instances of CAUTIs, CLABSIs, patient pain ratings, and how nurses addressed it, nurse courtesy, etc. Quality dashboards are important to give a snapshot overview of how a healthcare facility performs on quality measures and indicators. How is a dashboard used in nursing at the organizational level? A clinical dashboard is used by a healthcare facility in order to track quality measures and performances related to patient care and patient outcomes. A dashboard is used to improve quality statistics as well. How is data collected? Clinical dashboard data can be collected through chart audits to track charting consistency, patient incident reporting to track errors in patient care, and surgical counts before and after surgery. These are just a few examples of how safety measures may be tracked in a hospital setting. Individual indicators. Data is analyzed for yearly quarters in the dashboard. The sample nurse sensitive quality indicator reviews measures such as total falls, pressure ulcer occurrences, CAUTIs, and patient satisfaction indicators such as nurse courtesy, nurse promptness, and care instructions. All of these indicators are markers for efficient or inefficient care in a healthcare facility. These dashboards allow nursing administration to see what areas need most improvement, what areas have positive or negative values over or under the target number. For the presentation, I will focus on the CAUTI quality indicator. CAUTIs are a major indicator of hospital care and is an indicator for reimbursement through CMS, which will be discussed on the next slide. CMS can regulate reimbursement based on how well a hospital performs in the 6 measures listed above. Incidences of CAUTIs are within these measures that a hospital must score proficient in order to receive reimbursement. Without reimbursement funds, a healthcare facility can lose patient care quality, employees, and resources due to lack of funding. Catheter-associated urinary tract infections are highly preventable infections. There are evidence-based practices targeted at preventing CAUTIs, but a lack in observance and unconcerned nursing may be contributing factors to their continuance. CAUTIs are listed on the CMS website for reimbursement measures, as mentioned before, because they are, in fact, preventable and should be prevented. There are tested evidence-based practice guides that are proven to reduce CAUTI infection. These should be followed by all healthcare staff when caring for a patient with a catheter. However, proper care may often be overlooked in order to save time and effort. Johns Hopkins Medicine details evidence-based practice techniques that are and should be used more in order to prevent CAUTIs, and I will discuss 5 of those evidence-based practice techniques below. Hand hygiene should always be performed before manipulating or inserting a urinary catheter. Use of aseptic technique is critical when inserting a catheter. Ensuring hand hygiene reduces bacteria that could migrate up the catheter and colonize in the bladder or upper urinary tract, causing a CAUTI. Catheters should only be used when absolutely necessary and for the shortest amount of time possible in order to prevent infection. It is easy to overuse catheters in order to keep nursing work to more of a minimum in reducing toileting time for patients. However, this is not proper use. Empty the urine collection bag on the catheter regularly and avoid letting the bag become too full. If the collection bag becomes too full, urine backflow into the bladder may occur, which can contribute to CAUTI infection. Ensure staff is well educated on Foley catheter care and removal. Proper and routine Foley care is crucial to prevent infections, and poor cleaning may induce bacteria growth. Implementing protocols for nurse-initiated removal when catheter use is deemed unnecessary is also another way to help reduce CAUTIs. Allowing nurses to remove catheters at their discretion due to overuse may help cut down on CAUTIs. Doctors are not always aware of Foley use, therefore they cannot be relied on for removal orders. Nurse-initiated removal may help prevent CAUTI in reducing catheter use time. Proper patient care should never be sacrificed in order to save time or effort. If tested evidence-based practices are followed for catheter care or any nursing care or intervention, patient outcomes could increase dramatically and increase hospital reliability and credibility. Role of the BSN nurse in facilitating change. BSN nurses are well prepared on the nursing skill level and theoretical level in order to understand nursing processes and facilitate better patient care. In a study conducted by Linda Aiken, Ph.D., RN, FAAN, Director of Pennsylvania School of Nursing, a 10% increase in the proportion of nurses with BSN degrees was associated with a 7% decrease in patient deaths. This is which she found in a study published in February in The Lancet. BSN prepared nurses also have the knowledge to become change agents. A change agent helps others transform by advocating for openness and improvement. Nurses who act as change agents understand the change process and are committed to growth. BSN prepared nurses are more adept to facilitate and see through changes occurring in the hospital setting through leadership roles. Due to this, if more BSN educated nurses were present in hospitals, the rates of infections like CAUTIs may be reduced because these nurses see and understand the physical and financial ramifications of these infections. As mentioned above, infections like CAUTIs may contribute to patient mortality. Change will best occur with education. As more nurses become more educated on positive and negative values concerning quality indicators in nursing performance and patient care, a change process will occur more easily if indicated. Some ways in which CAUTIs may be addressed are with monthly staff training and regular catheter care checkoffs. I feel that this could dramatically reduce CAUTI instances and decrease infection rates for any hospital. Informatics and care outcomes. Health information technology can be used to track quality measures, performances, and outcomes in order to have tangible and transparent data for review by clinical leaders. Data can be entered into a computer to accurately track a patient's clinical path, like in a clinical dashboard which measures quality indicators. Microsoft Excel was used for the dashboard to track patient and nursing quality indicators like CAUTIs. in order to understand target misses and proficiencies. Patient data can also be monitored through electronic health records, documenting each stay and how the patient's condition changes over time. Health IT can help track instances of CAUTIs in order to understand the frequency of occurrence to provide data on how to reduce them. Health IT innovations continue to be associated with improved patient safety and quality related to chronic illness care and the prevention of patient falls, pressure ulcers, and medication errors, and CAUTIs as well. In summary, performance measures are used to gauge the quality of care provided by healthcare providers. Quality improvement refers to an ongoing process of innovation, prevention of error, and staff development that is used by institutions that adopt the quality management philosophy. By understanding where quality and performance decline, nursing management can take steps to improve or eliminate performance deficits. Nurses play a key role in quality improvement because they see day-to-day issues of real-world nursing involved in delivery of care. A way to help improve nursing performance deficits are to follow evidence-based practice research. Evidence-based practice guidelines have been tested and verified to produce the best results for patient care. The use of evidence-based practice prevents downfalls in quality indicators like CAUTIs. By using methods proven to prevent infections like these, the negative financial implications decrease for a hospital. Hospitals are evaluated based on performance measures like CAUTI occurrences by the Centers for Medicare and Medicaid Services and will be considered for reimbursement by such services based on how well performance is in quality indicator measures. Thank you for your time and listening to my presentation.